Hi, my name is Gordon Alexander, and I'm 71 years old. And I've been doing clinical Pilates with Emma for about 5 years since Emma started the program. What got me interested in doing the Pilates with Emma is that I had gone to an orthopedic surgeon and had an MRI on my back, and there was some disc issues, L2, 3, and 4. I had a couple cortisone shots that didn't work. I did acupuncture, which didn't work. I did chiropractic, which didn't work. And I was looking at perhaps, if I couldn't find anything, some kind of surgery, which I didn't want. I wasn't debilitated, but I always had this soreness and this ache and this problem in my lower back. So I'm not sure how I found Emma or vice versa, but I said, why don't I try Pilates? I knew nothing about Pilates. I think a lot of men don't know a lot about Pilates. I'd always been athletic, but it always been ball and bat type sports. And I think maybe men culturally are not predisposed to thinking that this kind of work is productive and can be healing. But I did start about 5 years ago. I've been with Emma since then. I do clinical Pilates with her twice a week. And then I do it on my own because what we do is mat work, not reformer work. So I can take what I learn in class to the gym, or if you have enough space in your home, you can take it home. All you need is a mat, you need a Pilates ring, and a firm ball, and you can do this. And as I said, it's been 5 years. I am not thinking about surgery. I've gone well beyond that. And I think as long as I keep up what I'm doing with Pilates, plus the other things I do, I still jog, and I still am an avid walker, and I still get out there. The only thing that bothers me a little bit now is when I do gardening for too long, when I'm on my hands and knees. But I think that's just age rather than anything that really is debilitating. So I would recommend this. I actually wish I had started Pilates much sooner, that it had been much more acceptable and known to folks, especially me, before the last 5 years. But the old saying, better late than never, certainly has proved true in my case. And I think it would be true in lots of other folks' cases as well.
Right, so Gordon, now that you have experienced it, let's say your best friend or a family member was struggling with pain and they were procrastinating over going to see somebody, what would you tell them about clinical Pilates right now?
Right, for me, Pilates was sort of the last resort. I had gone to acupuncture and chiropractic and MRI kind of stuff before. But what I would tell people is start with Pilates. And then if you want to do other things to check them out, fine. But the work that we do in Pilates on my core, on my balance, and the stretching we do for the lower back and the quads and the hamstrings and so on, I would recommend that people start with that instead of arriving at it at the end of your investigation.
Yeah. Now, of all the things you enjoyed about coming to see us, what was the thing you liked best?
Aside from Emma, the thing I liked best was the relief that I felt and feel from doing pretty much the same routine repetitively. I think consistency is the key. I don't think you get much out of anything if you go once a week and that's it. But I do twice a week, and I do once or twice on my own. So I think it's the 3 or 4 times, and the consistency comes from the fact that Emma's real clear on doing a similar set of exercises. We start standing up, and then we go to our back, and then we go to our sides, and then we go to our stomach, and then we go into the lotus position. So that made it easy for me to remember what to do and the sequence of the exercises. And that's what I enjoyed most, and what I got most out of the sessions.
That's great. And now, what are you able to do, sort of activities within your life that you maybe weren't able to do before you started coming?
Well, I used to play golf, and then I had stopped because golf, for anyone who knows, is not good for your lower back. So one of the things I'm going to do is to try to play again, but this time before that, do my stretching and do my core activities before I venture out on the golf course. I still jog and walk, but I've done less. But with Pilates, I'm going to try to get back and do as much as I used to do. Hopefully, Father Time will allow me to do that. But to tell you the truth, if I continue with Pilates and do my walking and get to do my gardening and work in the backyard within reason, I'm fine with that. I don't expect to maybe do what I did when I was 30, but certainly I'm doing a lot more now than I expected to do.
How about playing with your grandson?
That's what I do a lot of. Every Tuesday afternoon I see my grandson, and I'd see him more, but they live in Thousand Oaks, and so that's a little bit of a drive. The thing he loves most is jumping on me. And at a certain point, I said, Max, let's cool it on the jumping on me. But then the next day is Pilates, or actually a couple days after that. And I stretch and I work it out, and it's still okay if he jumps on me. So, yeah, I still play with my grandson, and my daughter is getting married this October, and they can't wait to, my other daughter is getting married this October. They can't wait to have kids. So I'm expecting to have other grandkids, jump on me as well. And life is good.
That's great, Gordon. Thank you so much for sharing your experiences. That's been brilliant. And let's go to class.
Let's do it.